You may have heard about the importance of vitamin D. I'll be breaking down how it works and why it's so essential. Vitamin D is a fat-soluble vitamin that is essential for many bodily functions, including your bone health, muscle health, and immune function. It's also known as calciferol. So there are two main forms of vitamin D, D2 and D3. Vitamin D2 is produced by plants, and vitamin D3 is produced by your skin when exposed to sunlight. Once vitamin D is in the body, it's converted to its active form, known as calcitriol. Calcitriol helps the body to absorb calcium and phosphorus from the intestines. These minerals are important in building and maintaining your bones. Vitamin D also helps to regulate the parathyroid hormone, and this hormone is important to keep the calcium levels in your body in a healthy range. Now, vitamin D may play a role in preventing some chronic diseases, including heart disease and cancer, but more research is required in this area. Now, when you don't have enough vitamin D, you can also run into some problems. Some of the common deficiencies due to vitamin D include rickets in children and osteomalacia in adults. Rickets is a condition that causes soft bones and deformities in children. Osteomalacia is a condition that causes weak bones and pain in adults. Vitamin D also helps to regulate your white blood cells, which are essential in fighting infections. Studies have found that people with low vitamin D are more susceptible to being sick from respiratory conditions such as the common cold or influenza. These people can also be more prone to getting sick with tuberculosis and HIV/AIDS. So how do you get vitamin D? So as I mentioned before, you get it from sunlight, which is the best way. You can also get it from food and from supplements. Some of the dietary sources of vitamin D include fatty fish, such as salmon, tuna, and mackerel. You could also get it from egg yolks, fortified milk, fortified orange juice, and mushrooms that have been exposed to sunlight. However, it's important to note you need to eat a large quantity of these foods, and usually it is quite impractical. So really the best way is from sunlight or supplements. So let's talk about how your body absorbs vitamin D from the sun. So when your skin is exposed to the UVB, ultraviolet B rays from the sun, a protein in your skin is converted to vitamin D3, which is the active form of vitamin D. The amount of vitamin D you produce from the sun depends on a number of factors, including your latitude. The closer you live to the equator, the more UVB rays that reach your skin. The time of year, so summer is when you're likely to get more UVB, and the time of day, again, the middle of the day is when you're more likely to get more UVB. Your skin color has a direct effect. People with darker skin produce less vitamin D compared to people with lighter skin. And of course, the amount of sun exposure, depending on how much of the body is exposed to the sun. So you should get sun exposure during the day. Between 10 a.m. and 4 p.m. is best in terms of the UV index. However, there is the risk of skin cancer with increased exposure to the sun. So usually between 12 noon to 2 p.m. is suggested to avoid the sun if possible. It's also important to note there is an interaction between sunscreen and the amount of vitamin D you produce due to the UVB rays. So when you use sunscreen, you're actually blocking some of the UVB rays that produce vitamin D. However, I would still recommend people use sunscreen, especially if you have lighter skin, as some UVB rays do still reach your skin despite the sunscreen, and we definitely don't want to increase your risk of skin cancer. Now, certain people work in an environment where they can't get enough sunlight, or parts of the world where you just don't have as many hours to get enough sunlight. In many of those cases, I would recommend you talk to your doctor or healthcare provider about what to do next, including supplementation. Supplements are usually in the form of cholecalciferol, vitamin D3. It is important to note that there is an upper limit that has been suggested, which is 4,000 international units or 100 micrograms per day for an adult. Too much vitamin D, of course, can lead to toxicity. Vitamin D has many benefits for your health. If you're not sure you're getting enough, talk to your doctor.